You had a child with teenage depression, and you were looking for the best approach. Is it wise to go to just a psychiatrist and get a prescription?
Well, there's actually, the research has been showing through the years that the best combat therapy is for teenagers to start with verbal, and only if the child starts to experience suicidal feelings, things like that, or if it's impairing their study habits, impairing their life, consider medication. But as you know, there was recently a study that actually came out showing that perhaps even more effective is if you have a team, which in this case would be like an individual cognitive behavioral therapist who's helping the kid change their belief system. Usually in depression, the idea is that the kid has formed some negative belief systems about themselves, low self-esteem, they feel they're not good enough like other kids. But then on top of it, they added a case manager. Now, I don't know all the details of it, but obviously what a case manager must be doing is monitoring the child, meeting with them periodically, discussing it with the therapist, and trying to help the kid perhaps get into activities. So that's actually what they were finding, and this recent study has been even more effective than standard therapy.
It would also be important, the case manager might make the kid feel that they're not alone, it's really a part of something, and maybe that alone might make it a little bit easier on the child.
Yeah, and then it makes a lot of sense. You know, when you see a therapist, basically, you see them once a week for 45 minutes. Here's a case manager, usually will have, based on all I know about case managers in all different populations, they usually have contact a minimum of 2 to 3 times a week in person, and perhaps even a daily phone call.